Hi, I'm Esther Avant. Rich and I recently had an awesome chat here on the podcast. I'd love for you to check out my podcast, To Your Health. With over 350 episodes, it's all about helping you stop starting over and finally follow through on your goals, starting with your health. You can find it wherever you're listening now.
Hey everyone, it's Rich Bennett. Can you believe it? The show is turning 10 this year. I am so grateful for each and every one of you who've tuned in, shared an episode, or even joined the conversation over the years. You're the reason that this podcast has grown into what it is today. Together, we've shared laughs, tears, and moments that truly matter. So I want to thank you for being part of this journey. Let's make the next 10 years even better.
Coming to you from the Freedom Federal Credit Union Studios, Harford County Living presents Conversations with Rich Bennett.
Slow pitch affairs.
It's probably the least sexy part of organizing. That's okay. No. The truth is.
So what happens when the doctor becomes the patient? Today, you're going to hear a story that cuts deep into the heart of the medical profession. One of extraordinary achievement, unimaginable struggle, and powerful transformation. Dr. Brett Cordes was living what many would call the dream, an overachieving, well-respected physician in the Texas Medical Center, building a thriving surgical practice. But behind the white coat was a secret, an addiction to prescription opiates that would one day become very public and nearly cost him everything. His story didn't end in disgrace. It evolved into redemption. After battling cancer as a young man and later fighting for his recovery from addiction, Brett has redefined his purpose. Today, he's the Burnout Doc, a certified life coach helping physicians overcome the very same pressures, burnout, and addiction that once nearly consumed him. In this episode, we'll talk about how cancer first inspired his path into medicine, how his hidden addiction unraveled his career, and how he's now using those life lessons to support others in the profession. So if you've ever wondered what it truly takes to rebuild from rock bottom and how to transform pain into purpose, this is the episode for you. So first of all, Brett, I want to say, number one, because you're in recovery, right?
Yes, sir.
So I want to congratulate you on that. And I also want to congratulate you on helping others and welcome you to the show, man. How's it going?
It's going well. I appreciate you inviting me. I'm looking forward to it. Man, you make me sound good on that intro.
Well, yeah, one of the things, especially if the intro, and I was going to ask you something else to start, but I think this is important because I don't think a lot of people realize how many doctors are actually struggling right now.
Yeah.
And you're helping them. I mean, roughly how many have you come across that you know of that's really struggling, whether it be with addiction or anything else?
Well, you've got, doctors aren't the first in line to ask for help. You know what I mean? And so, someone's not going to know that a doctor's struggling unless you are intimately involved with that person, unless you're a family, even a peripheral family member, a lot of times you don't know, unless you're a spouse.
Right.
But the truth is over half, 53% of all practicing physicians right now are burned out.
Wow.
So it's an epidemic problem. And it's only going to get worse.
All right, so I want to go back to the beginning, and when I say the beginning, I don't mean when you were in the womb, but before, let's work our way up to the addiction and becoming a doctor and the cancer. It was the cancer that came first, right? Or was it the addiction?
Yeah, no, it was the cancer, definitely.
Okay.
So I was, I'll just start. I was born and raised in Baton Rouge, Louisiana, and my parents, I had a pretty normal childhood. My dad was a mathematics professor at LSU at the college level, and my mom
nice.
taught English at LSU. So we lived in a very academic household. I mean, academics and achievement and awards and stuff that, those were placed at tip top priorities.
Right.
So when I was 7, 8, 9 years old, I really started to kind of equate their love and acceptance with my achievements.
Mm-hmm.
And so now this isn't something they ever told me or verbalized or even modeled really, but that was just kind of my misperception of what was going on.
Right.
And I mention that because that's going to be very important later on when we talk about, the causes of the addiction. But for now, consider my self-worth at this point in time tied to my achievements and how well I'm doing. But anyway, went to high school in Baton Rouge, went to college at LSU. And
if you don't mind me asking, now when you were going to college, what were you majoring in?
So history.
Oh, okay.
Yeah. So when I went to LSU, I had absolutely no idea what I wanted to do. We don't have
most people don't.
Right. We don't have any doctors. We don't have any people in the medical field in my family. Everyone's either an academician or an attorney.
Okay.
But no medical people. So I had no idea. Now, my mom had always said she thought I'd make a good doctor because I have a good smile. For whatever that's worth. But so at the tail end of my freshman year, and I'm majoring history, I'm taking all the classes to, graduate with that degree just because I like it.
Right.
But in March of 1996, I was diagnosed with Non Hodgkin's lymphoma, which is cancer of the lymph nodes.
Oh, wow.
And I was 19 at the time, and that was a huge shock.
Yeah.
And it didn't go away at first. We did treatment for 6 months, and then it recurred almost immediately. So ultimately I had to go through more chemotherapy, a stem cell transplant at MD Anderson in Houston, before it was cured. And overall, it was a 16-month battle.
Any idea what caused it?
No.
Wow.
No.
Anybody else in the family ever have cancer?
Not lymphoma. They've had other types of cancer, but not lymphoma.
Okay.
My mom had breast cancer. My dad had prostate cancer.
Okay.
But that was tough for a 19, 20-year-old who thought, he was invincible, like most teenagers. That was a wake-up call in humility for sure.
God.
But a silver lining that came, honestly, there are a lot of good life lessons that came out of that. But for these purposes, it's what made me want to go to medical school.
Okay.
I had seen medicine from the patient's perspective, and I could see and what I considered good pros and cons for being a doctor and bedside manner and this and that, and this person could have done that better or this. So I said, well, why don't I go to medical school and actually do it? So I have to credit my cancer experience with, eventually becoming a physician.
Right. So you I take it after the 16 months when you were in remission, that's when you went back to school and went for the medical field?
Yeah. So it took 16 months. I only took 1 semester off. So,
oh, wow. Okay.
So I was going to class, sick, for a lot of that actually.
God.
But yeah, so I graduated in December of 1999 instead of May.
Holy cow. And, all right. So how soon before you became a doctor?
So this was graduated in December of 1999, and I finished medical school with my MD in 2004.
2004. Okay. And that's how you ended up in Texas?
I matched into a residency program in Houston. Yeah.
Okay. All right. Yeah. So 2004. So you weren't in the field that long then.
When what?
In the medical field. Right? Because 2004 is 2025. When did you get out of the medical field? As far as being a doctor?
When did I get out of it?
Yeah, well, because you're no longer a practicing surgeon, right?
Right, correct. Oh, 2023 was my last year.
Okay, so recently. Okay, yeah. So all right, see, this is where all right, your father was the math whiz, right?
Yeah. Yeah.
This is where he would yell at me because I'm thinking 2004, is what you said. Okay, so you were only in the field for 10 years or whatever. I keep forgetting that was over 20 years ago.
Yeah.
Yeah, I keep thinking the 80s are still 20 years ago. It's an age thing. Okay, Brett, don't yell at me.
Well, I was in the field for 19 years.
Wow.
It wasn't. Yeah. It was a good bit.
Okay. So, all right, so you're in the field, and how did the addiction come about?
Okay, well let me back up, because during my cancer battle, and remember this was when I was 19 and 20.
Right.
I was prescribed opiates for pain. Now I didn't have a lot of
really
with the lymphoma. It didn't include my bones or anything like that. But I went through several surgical procedures and little biopsies and things, so I needed pain medication here and there. And I very distinctly remember when I would take it, it would feel like maybe a couple of beers. It would be a little bit of a buzz. It was okay, but it certainly wasn't anything to write home about. I never considered taking them when I wasn't in pain. I never considered taking them to get high, so to speak. It just never occurred to me, but they were pleasant, but they weren't anything earth shattering. And so I started working with a private practice in Houston in 2009. I graduated residency.
Okay.
And so, everything was absolutely perfect. Like you said in the intro, I mean, I really was living my dream. I had, married. My wife and I had 2 healthy young kids, living in the suburbs, working in the medical center. I loved it. I mean, I loved going to work. I loved my patients. I loved the operating room. And everything was phenomenal. So I think it was around 5 years into private practice. So this would put us around 2014. I started to get kind of bored. And now looking back on it, with my retrospectoscope, when I can look back and have time to analyze it, what I was really feeling was a lack of fulfillment.
Okay.
But at the time, I just kind of felt bored, because I had been climbing this mountain my entire life, this mountain of achievement, high school, college, med school, residency, this test, that test, this certification. I was 32 years old before I got my first real paycheck. So
wow,
I was, it was a long time. And so instead of relaxing, and instead of living in the moment and being present, and enjoying, the fruits of my labor.
Yeah.
The only thing that was on my mind really was, okay, what's next? What's the next challenge? What's the next achievement? What's the next accolade or whatever?
Right.
There was never a time where I just relaxed and enjoyed it.
Wow. Holy cow, man. 32 before you. That just. Yeah, I can understand why you would be bored. I would be pulling my hair out. What little bit I have left now. I mean, that's just, wow. So, all right, you were doing the prescription opiates, but it just felt like you were just getting like a slight buzz from drinking. That was it?
That was when I was 19.
That's when you were 19. Okay.
Yeah. So what happened is, it was just one random Friday afternoon, and my routine on Fridays was I'd get off of work early around 2:30, go home, and my wife and I would hang out at the pool with the kids, and I would drink a couple of, beers, and we'd start our weekend. But on this particular Friday, there was nothing special about it. A drug rep had brought in some cough medicine samples that had hydrocodone in it. And so when I saw those, my first thought was, oh, I remember hydrocodone. That's what the pain pills were. Those were okay. You know what I'll do? I'll take one of these cough medicine samples home, and instead of cracking open a couple of Bud Lights, I'll just take the hydrocodone.
Take that instead. Wow.
Yeah. And so what happened this time was that it was an earth-shattering experience. It was the most intense and prolonged euphoria I had ever felt in my entire life.
Scared the hell out of you?
No, it didn't scare me. It was the best. It was the best ever. It was
really
phenomenal. And I had to check and make sure it was the same stuff. But it was definitely the same stuff. And that one decision to take that little cough medicine sample on that random Friday eventually led to 6-year gradually descending life of chaos and in full-blown addiction.
Wow. So you were still practicing while in addiction then?
Oh, yeah. Yeah.
Did anybody know?
No, nobody knew for, let's say I was actively using for, let's say 5.5 years, maybe 6. Nobody knew for the first 4. And then my wife started to suspect.
Okay.
But she was the only one.
And when did she finally say something to you?
She finally said something to me in 2018, maybe.
Okay.
Not about 2018, 2019, something like that.
All right.
But opiates for most people make them sleepy or groggy.
Yeah.
For me, it gave me energy. The
opposite.
It increased my motivation. It made me feel euphoric. I was convinced that I was a better doctor. I was a better surgeon. I was a better father and spouse when I was high because everything just felt perfect.
Yeah.
And I truly believe that. The amount of mental gymnastics that I had to go through to justify using drugs while working as a physician and surgeon is tremendous. But an addict does what they have to do.
I never heard that term, mental gymnastics. I like that. I got to steal that phrase. All right. So what was the trigger in your brain that finally said, enough's enough? I need to stop.
Okay. So that happened. I would say I, for the first time, considered myself a drug addict, probably in 2017. Because up till then I had never tried to quit. I didn't see a reason to quit. I really wasn't having any negative consequences. So why quit if it's a good thing?
Mm-hmm.
But I decided to try to quit in 2017 to prove to myself that I could. And I could not. I mean, if anyone has any idea what opiate withdrawal feels like, it is not a fun experience. And so by the time it was 2017, I was having to use just to prevent the withdrawal symptoms because I was physically dependent on it at this point. So I couldn't quit though. I could wean myself down about 70% of the way, but I could never complete. And so I knew I was a drug addict and I knew I could not stop, certainly by the time 2018 rolled around.
Holy cow. So how long before you finally went into recovery? And actually, was it a facility you went to, or did you, especially being a doctor, because, and we mentioned this, sometimes doctors don't ask for help. Sometimes people don't ask for help in general.
Yeah. Yeah. Well, no, I definitely can't give myself any credit for getting well. Because what happened in 2019, my partners found out about this and they called me into the office and they fired me right off the bat.
Oh, wow.
So this was in April of 2019. And I didn't go to rehab until July of 2020. And it was mandated by the state medical board that I do 3 months at a residential treatment facility.
3 months. Okay.
Yeah.
All right. So, and if you don't want to answer this, that's fine. But that day that you got fired, how did you explain that to your wife?
I told her that, well, I lied to her and told her that, they suspected that I was taking opiates and I wasn't, and that I'm sure it would get cleared up.
Okay.
That was what I first said. And then, it didn't take long, a week, maybe 10 days when I had to just tell her, look, this is what I've been doing. They found out I'm out of a job.
Wow.
It wasn't an easy conversation, that's for sure.
Oh, no. And when you started going into recovery, or when you went to recovery the first time, I take it she stuck with you? She was behind you 100%?
She was, yeah. She was incredibly supportive. Yeah.
Okay.
And same with my parents. I mean, that was a brutal phone call. I called my parents from the rehab facility to let them know what was going on. And so that's kind of a parent's worst nightmare, at least one of them. But yeah, July of 2020 through September of 2020. And now this was in the middle of COVID.
Yeah.
If you'll remember.
Yeah, I know.
So you want to talk about isolation. You're isolated from society, and then inside the rehab, you're isolated because of COVID. It wasn't fun, but it was what I needed for sure. I had a great experience in rehab.
Now, did you go to rehab where you were close to where you were living, or was it another state? Because I know sometimes people will go to a different state for rehab.
Yeah, I went to I went to Louisiana. I was living in Texas at the time.
Okay.
Yeah, and this was a rehab way up in the middle of a cow pasture in northern Louisiana.
Wow.
Yeah.
Good therapy hanging out with the cows, though, you think
Right.
about it. Hey,
Yeah.
and I brought up the part about, your spouse, and I'm glad you mentioned your parents, because we talk to people in recovery all the time, but a lot of times we don't talk about how it affects the spouse and the family. And actually, how were your kids through all this?
Yeah. Well, yeah, it is. I mean, it is absolutely brutal on the spouse. And really any loved one. It's brutal because you see this person that you love. First of all, they change into a different person. And they're making decisions that are completely out of character. I would hate to have to watch a loved one go through that. My kids found out when everyone else found out. So they had no idea at the time what was going on. And let's see, how old were they when I found out? They were like 14 and 12, I believe.
Oh man.
When this all blew up. So.
All right. So you're in recovery. You're no longer a doctor.
Well,
what? All right, let me rephrase that. Yeah. You're not practicing, right?
Correct.
Okay. So what was it that you said, you know what? I am going to start helping people, and that's when you decided to become the Burnout Doc. I'm sorry, I just love that. The Burnout Doc. Sounds great, man.
Thank you.
When was it when you decided to start doing that?
I decided to do that in 2023. So.
Oh, wow.
But I went back to work first.
Oh, okay.
My medical license was suspended in 2020. And it was supposed to be suspended for one calendar year. Mm-hmm. But because of COVID, and because the medical board is not real efficient at doing anything, honestly, it was 2.5 years that my license was suspended. And by this time I had moved to Louisiana. So I had to wait till my Texas license suspension was lifted. Then I had to ask for a license in Louisiana and then go through the probation period. So I didn't go back to work until 2023. And recovery is tough. Okay?
Oh, yeah.
Recovery is tough, but the lack of fulfillment and the isolation of being out of work for 4 years was even worse for me.
Wow.
It was brutal. But yeah, I went back to work, signed a 1-year contract in 2023. I do ear, nose, and throat, by the way. I'm an ENT surgeon. So went back to work for a year in 2023, and it was good. It wasn't great though. It was pretty obvious that I had kind of fallen out of love with clinical medicine.
Right, what you were doing, yeah.
Yeah, I mean, I love my patients, still love the operating room, but in the 4 years that I was out, the amount of bureaucratic garbage that doctors have to deal with seemed like it tripled like in 4 years. I was spending more time doing that stuff than seeing patients. So, and it was frightening to kind of come to the realization that, man, I don't love doctoring anymore.
Yeah.
And I just happened to run into someone I did residency with in Houston. I just happened to run into her online. And she was doing this. She's a life coach for surgeons. And so we started going back and forth and talking. And she was like, Brett, with your experience and what you've been through, you'd be a great life coach. And then I just started thinking that, who else better to serve than physicians who are burned out so that they don't crash and burn the way I did.
Right. That I was going to say, and you don't have all the bureaucracy with it right now either, do you?
Right. Yeah, no, there's no insurance
you never
company.
will. Yeah.
Yeah, no insurance companies.
You're listening to Conversations with Rich Bennett. We'll be right back. Cancer is a serious public health concern that affects many people. It can be a difficult and frightening experience for those affected and their families and friends. I want to urge everyone to take steps to prevent and detect cancer early. There are many things you can do, such as eating healthy, exercising regularly, getting regular checkups, and avoiding risky behaviors. Let's work together to make sure that everyone is aware of the importance of public health and cancer prevention. The Harford County Health Department offers no-cost screenings for colorectal cancer as well as breast and cervical cancer through their partnership with University of Maryland Upper Chesapeake Health for eligible individuals. Go to harfordcountyhealth.com to find out more information. You started this, which I think is great because I think it's definitely something that's needed. If you don't mind, because I really love hearing these, can you share a feel-good story about, and you don't have to mention their names, of course, about somebody that you were able to help?
Let's see. Well, I do have a feel-good story. We'll do a feel-good story. So, I was treated at MD Anderson with a stem cell transplant for cancer back in 1996, in 1997. And at the time, a stem cell transplant, when the stem cells came from the patient, it was an experimental protocol. Mm-hmm. And so it was a big deal. And there were 10 patients in this protocol that were getting stem cell transplants, and only 2 of us survived. So, I grew up after that. I mean, I really, and I still kind of struggle with survivor's guilt. What's so special about me that I was able to survive and all these other people didn't make it. But so when I went to residency to train in Houston, I trained at MD Anderson for 6 months doing head and neck surgery. So, I was walking the halls of MD Anderson as a resident surgeon, mm-hmm. in the same halls that I was as a patient, 20 years prior to that. It was, you want to talk about a surreal experience. That bet. Was nuts. And so, we're head and neck surgeons at MD Anderson, but I'm still an ear, nose, and throat doctor. So we got consults within the hospital for nosebleeds a lot. So I went to see this patient who had a nosebleed, and I recognized his doctor's name because it was my doctor. And I'd been seeing this guy every 3 years. And so his name was Dr. Roma Guerra. And so when I went to talk to Dr. Roma Guerra as a surgeon who had just helped his patient's nosebleed. So I introduced myself. Hey, Dr. Roma Guerra, my name is Brett Cordes. I'm one of the head and neck surgeons here. I just got through seeing Mr. Johnson, and his nosebleed is tidied up. And by the way, I want to thank you for saving my life. And, he was writing something down at the time. And so he looked up at me, and I could tell he could recognize me, but he didn't know my name, but he could recognize, and he was trying to, place it. And so we got up from his desk and just kind of walked over to his bookshelf. And on his bookshelf, he had framed a handwritten letter that my dad had written him 20 years prior to that. Oh, wow. Just thanking him for being a great doctor. And, his bedside manner was fantastic. He was just the most wonderful. It was just incredible. And so he went and he picked up this framed letter that my dad had written him, and said, wow. It was just, there was not a dry eye in the room. I was just going to say, man, where was the Kleenex close by? Yeah, that was a pretty powerful, powerful experience. But wow, I definitely would be. I'd probably be bawling my eyes out once I saw that. All right, talking about physician burnout. Yeah. Why is it such a massive but often hidden issue, even nowadays? Yeah, well, so as boring as it is, the main cause of burnout is all these what I call bureaucratic tasks. So, if I see a patient for earwax, for example, take the earwax using a microscope. That's a level 2 visit. Takes me 10 minutes, and then I'm seeing the next patient. But to do the paperwork involved in just seeing an earwax removal patient, it takes 7 employees.
What?
Because you've got to check them in. You've got to take their vital signs. I've got to see them. Then on the back end, you have to check them out. Then the insurance people have to run their insurance. And then the collection people have to collect payment from the... You would not believe how much is involved in seeing a patient for something so straightforward. And eventually, a physician spends, 60% of his day doing that stuff.
Right.
That's not why any of us went to medical school. And so that's the biggest cause of burnout. And then another cause, which is, closely tied to that, is dealing with the insurance companies and being told how to do your job by an insurance agent.
Yeah.
That I went to school and trained for till I was 32 years old. Now I can't do what I need to do without the permission of someone else. That's another separate cause of burnout. So it's rough.
All right. So since you've been in the field, you're right. The bureaucracy is it's ridiculous. But does it seem like you're seeing more and more doctors getting out of the business because of all that crap?
Absolutely. Yeah. And well, when COVID hit, the burnout rates went up, and almost any doctor who was near retirement age and thinking about retired, they just went ahead and retired. But what's crazy is that the burnout rate for doctors is higher now than it was during the height of COVID.
Really?
Which, if you think about it, is scary. I mean, you go see a doctor, there's a greater than a 50% chance that they're in full-blown burnout. So it's not good. Like I said, it is a problem truly of epidemic proportions.
Actually, how do you help the doctors who are afraid to admit that they need help, especially if they're afraid of losing their license or reputation?
Yeah. So talk about roadblocks to get help. First of all, the general public as a whole, nobody wants to hear doctors complaining, right?
Right.
Because the perception is that doctors are rich and that, we might work hard, but we're working in an office in the air conditioner, and people just don't want to hear it.
Yeah.
Complaints from them because of the misconception. So you feel bad about even bringing it up to lay people because of that. You can't bring it up within the medical community because it is a real fear that if the medical board finds out that you might have a mental health issue, that could impact your license. And so there's nowhere to go. And this is on top of the fact that doctors don't like to ask for help anyway.
Right.
And so doctors will not go to a psychiatrist for burnout or for mental health issues as a whole anyway. So there really is very, very few options for physicians who actively want to try to dig themselves out of the hole of burnout.
All right. So with your business now, the Burnout Doc, especially since you've seen what doctors are going through, but at the same time, you're also in recovery. Are you only, as the life coach part, are you only helping other doctors, or are you helping basically almost anybody?
Yeah. So, my business model is to help other physicians.
Okay.
But I will treat anyone in the medical field. And I've had some potential options of treating other non-medical professionals. Basically, anyone who has a job that has a state licensing agency. So engineers or architects or, I have not treated them yet. So I'm really confined to the med field, and especially just to other physicians, because that's what I was. People want to be helped by someone who's walked in their shoes, so to speak. And not everyone has a substance abuse problem in burnout. But almost everyone is addicted, and I put that in quotes, to something. They have some sort of coping mechanism that they're having to rely on that
100%.
isn't healthy,
100%. All right. So you might have to think on this for a minute. All right. Looking back, what do you wish your younger self had known about boundaries, burnout, or asking for help?
Yeah. Well, that's easy. I would have listened to my partners, because from day one, literally on the very first day of work, they told me, maximize your vacations, take 3-day weekends, take time off, take at least 1 day off a week, maybe even a day and a half off a week. So they would tell me that all the time so that I wouldn't get burned out. But I was having so much fun. And I loved what I was doing, and I loved my patients. I did not feel burned out ever, really. That boredom that I talked about previously, that was actually the first symptom of burnout, but I didn't know it at the time. And so I would have listened to my partners and taken more vacation, and also developed some hobbies and passions completely separate to medicine. That's what I would have done differently.
Yeah, you just mentioned that the boredom is a symptom. Yeah, hello, running lips here. A symptom of burnout. What other symptoms are there, especially for? I mean, especially for doctors, but I think with burnout, a lot of people can recognize some things, but may not know the symptoms. What are some of the other symptoms?
Yeah, well, I tell people to think of a grumpy old crotchety old man syndrome. But basically, the biggest symptoms are irritability, and people have a lower threshold for frustration.
Okay.
And then they start to get angry, and depression and anxiety, and that starts to happen, but it's usually confined to work. When you go to work, you feel these things, but when those emotions follow you home, you're deep into burnout by the time that happens. When your spouse and kids and family and friends begin to notice a change in your personality, you're deep into it. Because for doctors, it's more than just a profession. It's really part of our identity.
Yeah.
And so it's not just a job to most physicians.
Right. So with you, you're helping doctors just where you're at or anywhere, especially now because of the internet.
Yeah. I have a website called theburnoutdoc.com, but everything's done over Zoom, so I can treat anyone anywhere in the world.
And I'm glad you said that, because I know with certain things, and I think especially like therapy, like I think you have to have a license or whatever in the states that you're doing it, even if you're doing it over Zoom or whatever.
Absolutely.
But with being a life coach, I guess you don't, right?
You're correct. Yeah,
which is, I think, why a lot of people are going that way. And
at this point in time, there's no governing agency over coaching. Now, there are a couple of certification agencies, and I'm still getting my certification. It's a long process. The one I'm doing is about an 18-month process. So but I wanted to do it the right way.
Right.
And I wanted people to have confidence, my clients to have confidence in my training. So I will be certified probably certainly by 2026, and probably sometime in 2025.
Well, and I'm sure there's probably even other certifications that'll come out after that as well.
Right. Yeah. It won't be long until the entire industry of life coaching is, hopefully it won't be under the FDA or anything like that, but it'll be a little bit more organized.
All right. So Brett, when's the book coming out, man?
Well, it's funny you mentioned that, because I did write a book. I did write a memoir about my cancer experience. Yeah. And that came out.
Really?
That came out in 2020. Yeah.
Well, all right. Is the book still available?
It is. Yeah. It's available on Amazon.
What's the name of the book?
Cancer is for Older People.
Oh, wow.
Yeah. And it talks about my experience and how it made me become a doctor, and a lot of other stuff too. It's basically a memoir.
I'm glad you said that because, those of you listening, make sure you purchase this because a memoir, I've always found, especially, when you're reading something about somebody else that's been through it, it helps a lot.
Oh, yeah.
I know when my mother had cancer, the book that helped me get through it and then in turn helped her and she went into remission was Tuesdays with Maury. By Mitch Albom, talking about Maury Schwartz, who had ALS. Was it ALS? Yeah, I think it was ALS. But when you read about somebody, a true person that is sick, and to see how they go through it, and I guess you could say the life lessons learned in it, it helps a lot. Now, granted, when she went into remission, she went back to smoking, and it's like, oh God, something. All right, so before I get to my last question, which is going to be tricky for you,
okay,
is there anything you would like to add?
I would just like to add, I am not the only person that is available to treat burnout in doctors. There are other physician coaches.
Right.
But I do think that coaching, and there are actually studies that support this, that coaching helps with the symptoms of burnout. But I would consider getting a coach to help you out of burnout if you're a doctor and you feel like that's an issue for you. And so, and we're all internet based. So my website is theburnoutdoc.com. But there were other people available that do the same. Not very many, but
right.
And hopefully there'll be much more in the future. Because once doctors hopefully start asking for help and other physicians see how much they improve, the entire business will get bigger, and which will be a win-win because that means less physicians are burned out, and it would be better for doctors and patients and the general public. So
sounds like the group of you should start your own networking group.
Yeah, maybe.
Yeah, because think about it. There may be somebody that another coach is helping, but they can't get through.
Yeah.
But perhaps you could, and vice versa.
Yeah, and my resident partner, we have a very, very loose association, but she's a woman, and so sometimes female physicians prefer female coach. And
exactly.
So, yeah.
All right. So this last question, this is going to be based on a number you pick.
Okay.
This is something that I started a little bit ago, and it's 50 random questions. I have no idea what the hell they are. So pick a number between 1 and 50.
Okay, 20.
20. Why 20?
That's my favorite.
That's not the question, by the way. All right. Oh, okay. This is a good one. This is actually a very good one for this. What's the most challenging idea you've ever had to grapple with?
The most challenging idea that I have had to grapple with, okay. I think I have one.
Okay.
It was the idea that I could not beat my addiction by myself, and that I had to ask for help and receive help from another person in order to do that.
Do you think that was the doctor in you?
It could be, and when you're in active addiction, you're not really
well, yeah.
You think you know everything, but it's at a much deeper, recovery is a lot of psychology, and you really have to look within yourself and learn about yourself, why you do certain things. But, when I was in my addiction, my ego was through the roof. I thought, I could quit if I wanted to. I just don't want to.
Right.
But really realizing and acknowledging the fact that I'm going to need help from another human being to beat this that's going on inside me. That was a very hard idea to wrap my brain around.
I think you need a follow-up to that memoir, because you say your memoir was about you fighting cancer.
Yep.
But nothing about recovery.
That's right.
See? The sequel.
There might be something there. Yeah.
Well, Brent, I want to thank you so much, and thank you for everything you're doing and all the help you're providing. Again, those of you listening, if you feel, doctors, especially if you feel like that you need Brett's help, go to the burnoutdoc.com. And those of you listening, also purchase his book, which is titled what again? Cancers for older people.
Yep.
I just love that title, man.
And I might just say I had two friends who were co-authors, so it follows the experience of myself when I was 19, and then one of my friends was a mother in her 30s, and the third co-author was a father in his 40s. So it's got something for everybody.
So it's basically 3 memoirs?
Correct.
Wow.
And these are personal friends of mine, so it's how we all kind of intertwine and connect and support each other. And we were all treated at MD Anderson with a stem cell transplant. That's another commonality. So these were friends that I had prior to them getting sick. It wasn't right. They're not cancer friends, so to speak. But yeah, so it's neat. There really is something in that book for anyone, whether it's a person going through cancer or a loved one or a friend, because it's not fun to watch a loved one go through cancer or addiction. Both of them are very challenging.
Well, I'll make sure I'll find the book and put a link to that in the show notes as well, and especially after I purchase my copy.
All right.
So, Brett, thanks a lot, man.
Okay, thank you.
Thank you for listening to Conversations with Rich Bennett. I hope you enjoyed today's episode and learned something from it as I did. If you'd like to hear more conversations like this, be sure to subscribe to the podcast so you never miss an episode. And if you have a moment, I'd love it if you could leave a review. It helps us reach more listeners and share more incredible stories. Don't forget to connect with us on social media or visit our website at conversationswithrichbennett.com for updates, giveaways, and more. Until next time, take care, be kind, and keep the conversations going. You know, it takes a lot to put a podcast together, and my sponsors help out a lot, but I also have some supporters that actually help me when it comes to the editing software, the hosting, and so forth. There's a lot that goes into putting this together. So I want to thank them. And if you can, please visit their websites, visit their businesses, support them however you can. So please visit the following: Real Life Prosthetics, cutting edge solutions, restoring ability since 2001. Go to reallifeprosthetics.com. Full Circle Boards. Nobody does charcuterie like Full Circle Boards. Visit them at fullcircleboards.com. Sincerely Sawyer Photography. Live in the moment. They'll capture it. Visit them at sincerelysawyer.com.